My name is Purnima Menon and I work at the International Food Policy Research Institute. We are a core part of the Alive and Thrive team and lead the work on the measurement, learning and evaluation around the project. We are basically trying to answer two broad sets of questions: what impact Alive and Thrive has, how the project achieves those impacts. So we measure the anthropometric outcomes, heights and weights of children and their mothers. All of this involves collection of a lot of data. We have around 4,000 households. We have 4,400 households that were covered in Bangladesh and 4,000 households in Vietnam. And then in Ethiopia, where we don't have intervention comparison group, but just one group, we have 3,000 households. These are in Bangladesh, these 4,400 children come from 200 villages. And then implementing the survey itself is a really substantial undertaking because we are working with large samples. We have often 30 to 40 interviewers that do the surveys, and they have to be trained very well. Usually they're trained for 3 to 4 weeks, often including being standardized and doing anthropometric measurements so that we can be really sure of the precision and the accuracy of what we are capturing. The surveys were all done, unfortunately, in pretty hot weather and pretty wet weather in all three countries. So we had some, quite a few challenges in just implementing the field work, but we worked with some very, very dedicated field teams who have literally crossed rivers, walked miles and miles, spent days and nights in remote villages to do the interviews, and the quality of the data is really excellent. What's always nice is to see how the communities even welcome the survey workers. I mean, we often think that these long surveys are real burdens on households. And, indeed, to some extent, it is burdensome when somebody comes and asks you a lot of questions. But often people are just intrigued and excited by the fact that somebody cares to know so much about their lives. In terms of how we use the data, well, firstly, we use the data to benchmark the key Alive and Thrive impact indicators before the interventions roll in the communities. And so we've done that now. We have the benchmark for where we are. The endline surveys will have pretty much the same format. They'll cover the same age groups. They'll be done 3 years, exactly 3 years from when the baseline is done. These baseline and endline surveys will help us document the impact of Alive and Thrive's interventions on infant and young child feeding practices and undernutrition in the Alive and Thrive countries. We're very excited about this evaluation and think that the stories and the results of the evaluation will be very instrumental in helping to inform policies and programs globally.